This upcoming Medicare annual election period, or AEP for short, may be one of the most significant in recent memory when it comes to changes that impact Medicare beneficiaries, particularly relating to Medicare Part D prescription drug coverage due to the Inflation Reduction Act passed by the Biden administration several years ago at this point. Now, the reason why this is such a significant change and so much domino effect can be seen from these changes is because the most significant portion of the Inflation Reduction Act that impacts Medicare Part D prescription drug coverage kicks in January 1st of 2025. I'm indeed speaking about the $2,000 mandatory maximum out-of-pocket cap that Medicare Part D prescription drug plan sponsors or insurance companies have to abide by. You'll actually see the effect of this come October, because when October comes, that's when Medicare annual enrollment begins. And typically when people are shopping during Medicare annual enrollment, they're looking at plans for the 2025 plan year. Now, we've done videos before, and there's only so much time we have to talk about this in this particular video, about the impact of the Inflation Reduction Act on Medicare Advantage plan benefits, on Part D prescription drug plan benefits and premiums. But in this video, we're going to specifically talk about the bullet points of what you need to know about Part D plan changes due to the Inflation Reduction Act. My name is Christian Brindle. I'm a licensed insurance agent. We specialize in Medicare health plans, and I'm the CEO of Christian Brindle Insurance Services, also known as Everything Senior Insurance. We're licensed in over 45 states to help you with your Medicare health plan. Check the description down below in this video, and we will be able to reach out. If you'd like to have a conversation with one of our team members and one of our licensed brokers and specialists, make sure to check out our contact information down in the description of this video, and we'd be happy to help you. A majority of places in the country, we are licensed and certified to assist. There's no cost or obligation for our services of any kind, and we represent a multitude of different insurance companies. Now, when it comes to the Inflation Reduction Act, we've already discussed the mandatory $2,000 cap on prescription drug costs that a Medicare beneficiary can be responsible for. And in years past, most notably as recent as 2023, there was no maximum out-of-pocket cap that seniors could be stuck with when it comes to their Medicare Part D prescription drug plan. There was an unlimited amount that they could potentially be responsible for. They never actually got to a point where they were 100% covered. Okay, this was because Medicare was built in on different stages over the course of the calendar year when they used their plan, and it was based on usage. So you had things such as the donut hole, or also known as the coverage gap. You also had things known as catastrophic coverage. Well, the donut hole and the coverage gap will be going away entirely in 2025 because of this $2,000 cap. What we're typically going to see, though, is a lot more Medicare beneficiaries are going to get closer to spending $2,000 that never came close to that than they ever did before, because to combat these extra costs, insurance companies are most likely, we believe, to increase their co-insurances and co-pays and deductibles to combat these additional costs they're going to have to incur. Not to mention that we should expect to see premiums go up on the individual standalone Part D prescription drug side, and Medicare Advantage benefits potentially deteriorating and pulling back in other areas to combat the extra cost of prescriptions that they'll have to endure. The main things that you need to be aware of is part of what the Inflation Reduction Act did outside of the $2,000 cap is it increased and expanded the Medicare Insulin Senior Savings Program. Now, the Medicare Insulin Senior Savings Program was a program that allowed insurance companies to choose to either opt in or opt out of this program. And what it meant was it would guarantee Medicare beneficiaries a $35 copay and no more than that on a month-to-month basis, whether they had met their deductible or not, or whether they were in the coverage gap or donut hole or not. And the only criteria was the insurance company had to opt in and participate, and the insulin in question had to be on the formulary, and it had to be one of the chosen insulins that were put into play for this program. What the Inflation Reduction Act did was it took the insurance company's ability from being able to opt out and required all of them to participate. And it's a mandatory requirement, which we believe to be a good thing. So that is a good change that the Inflation Reduction Act did. Another piece of the puzzle for the 2025 $2,000 cap is that Medicare is putting in a mandatory payment plan system for the insurance companies and for Medicare beneficiaries that insurance companies are going to have to follow. The math of this can get extremely complicated. Without going too far into the weeds, I'm going to do my best to explain this now and what this looks like. So the way it will work is if somebody gets to the point where they are reaching their $2,000 maximum out-of-pocket cap over the course of the year, and it's being done all at once or in a very short period of time. Maybe it's a 30-day period, maybe it's a 60-day period if they're taking relatively expensive brand name medications. The insurance company at that point will pay the claims in full to the pharmacy, so the pharmacy is satisfied, and then the insurance company will work with the member to create a month-to-month payment plan where they pay a set amount of money and a set payment over the course of the year to pay off this balance that they owe to the insurance company. Now, while that might be nice and while that might be a positive thing for some to where they don't have to come up with $2,000 right off the bat, it still puts the member and the Medicare beneficiary in a situation where if they were spending less in 2024, 2023, and previous years, and they get closer to that $2,000 limit and they even essentially hit that limit, they're still going to be paying more in prescription drug costs than they would have in years past. And we believe this is because the insurance companies will not be able to sustain the increased coverage they're required to now provide while still providing all of the same costs and benefits and premiums that they have in recent years. Now, the positive thing about this is the Part D plan is not able to terminate your Part D prescription drug plan if you miss a payment. They can continue to try to collect payment from you, but they cannot drop you as a result of you missing that payment. So that is an important detail to know. This will be voluntarily available to all Part D members and enrollees, whether you have it through a Medicare Advantage plan or a standalone Part D prescription drug plan with a Medicare supplement plan. The program enrollment will begin October 15th, 2024. Beneficiaries that are likely, in the eyes of the insurance company, to fall into a situation where they could benefit from this program will be notified and must be notified from their insurance company that they're enrolled with. Other aspects of the Inflation Reduction Act that we have yet to see the results of have to do with the government and the manufacturers and the pharmaceutical companies working together to negotiate the retail value of the costs of some of the most expensive brand name prescriptions and the most commonly seen brand name prescriptions that people are likely to see. They come up with a list of these prescriptions every year, and every year they go with the manufacturer and they're going to be negotiating these retail costs down. If successful, this will be a very positive thing due to the fact that Medicare prescription drug plan coverage, co-payments, and coinsurance is largely impacted by the retail and total cost that is charged for the prescription, not just the beneficiary copay. Now, while I have on this channel been skeptical and maybe even a little pessimistic of these new Part D prescription drug plan regulations and overall impacts, I do think there are those on Medicare that will be highly impacted in a positive way and benefit from these new rules. There's a lot of people on Medicare in the country that are spending thousands of dollars a year in Medicare prescription drug costs and coinsurance and copays. Those individuals will be helped substantially by having their prescription drug costs capped at $2,000. I also feel like beneficiaries that are on a budget that will have a difficult time coming up with $1,000 or $1,500 or $2,000 to pay for prescription drugs, having the ability to break it up onto a payment plan is a very positive thing, and I am in approval of that. We have already seen some insurance companies that offer Medicare Advantage plans and Part D prescription drug plans exit the arena and not provide services in 2025 to members in any kind. We won't say any names of any particular insurance companies because some are not public as of yet. However, we do believe that we will see more of this, and the insurance companies that stay, we will see a lot of plan cancellations. We will see a lot of premium hikes on individual Part D prescription drug plans to combat this, and these are the negative impacts that Medicare beneficiaries are going to face this coming annual enrollment period. Also, as we've discussed, as mentioned earlier in previous videos, a lot of Medicare Advantage insurance plans are going to see massive changes in their overall benefits, more than we've seen in recent years. Instead of a plan maybe deteriorating its prescription drug coverage to combat these additional costs, they might deteriorate another area of their plan. Maybe their medical co-payments rise. Maybe their maximum out-of-pockets go up. Perhaps their formularies dip on the prescription drug side. Perhaps their networks shrink. Perhaps their ancillary benefits, such like dental, vision, and hearing, take a little bit more of a back seat than they have in the past. And I do believe every insurance company and every single Medicare Advantage plan will have choices to make this coming selling season and this coming enrollment period, and we will see a domino effect because of this. Our office and our team and our organization are here to help. There are a multitude of clients of ours that we are going to need to get with and reassess their plan, because things will be very different in 2025, this open enrollment period. If you find yourself without help, without assistance, without guidance, we would love the opportunity to be able to help you with your plan. Again, as I mentioned earlier, our services are no cost to you. We simply evaluate your options and help you find the best plan based on your needs and preferences. And we work with a multitude of different insurance companies around the country and nationally. Not to mention, there is no obligation to work with us. So if you have a conversation with us and maybe for some reason you did not feel good about it, there would be nothing requiring you to work with us. So it never hurts to have that conversation. And this upcoming open enrollment, it might be more important to do so than ever before. I hope you found this video helpful, educational, and bringing to light some of these things that are coming for this Medicare annual election period. We'd love to help. Make sure to like this video if you found it helpful and educational. It helps more beneficiaries just like you on Medicare find this information that desperately need to be aware of what's coming. Make sure to subscribe. We put out weekly videos to help you with your Medicare and provide helpful tips and additional information. Make sure to comment your thoughts down below. Do you feel like this is a good thing? Do you feel like this is a bad thing? We'd love to have a dialogue with you about this. Thank you so much for watching, and we'll see you next time. Happy Medicaring, everybody.